Please mention in the chat box. So in today's session, we will be doing mental health nutrition. Those who are joining late, please inform them about the topic. Page numbers are not available. These are out of syllabus topics just for your information. It will not be asked in exams whatsoever, just for your information and factual knowledge. So eating high quality food that contains a lot of vitamins, minerals, and antioxidants nourishes the brain, protects it from oxidative stress. The waste, which we call as free radicals produced when the body uses oxygen, this can also damage cells, and it can also damage the nerve cells, brain cells, which may lead to some disease conditions as well. Okay, if your brain is deprived of good quality nutrition or free radicals, or any damaging inflammatory cells are still circulating in your body, you are undergoing through any chronic inflammation, okay, and damaging inflammatory cells are again circulating in your body, this can also lead you to certain disorders, okay, brain tissue injury, and along with that some mental health issues can again follow. Okay, so basically the slide wants to tell you that free radical damage can affect your mood as well, it can affect your mental health as well. Okay, which means if you want to tackle free radicals, you have to add more antioxidants in your diet. Okay, how are diet and mental health linked? Eating well can help you feel better. You don't have to make big changes in your diet, but see if you can try some of the following tips. Eat regularly. This can stop your blood sugar levels from dropping, which can make you feel tired and have a bad temper. When you have low blood glucose level, you get irritated easily. Okay, and you will feel lethargic overall. Stay hydrated. Even mild dehydration can affect your mood, energy level, and ability to concentrate. So always stay hydrated. Eat right balance of fats. Your brain needs healthy fats to keep working well. And these are found in things such as olive oil, rapeseed oil, nuts, seeds, oily fishes, avocados, milks, eggs, dairy products. Okay. And try to avoid as much as possible trans fats. Okay. And try to often found, which is found in processed and packaged food. They can also be bad for your mood, for your health, heart health as well. So try to avoid any packaged food. Try to avoid processed food. Okay. Include more whole grains, fruits, vegetables in your diet. They contain vitamins and minerals for your brain. Your body need to stay healthy and well. Include more protein in every meal. Okay, it contains amino acids, and that your brain can use to help regulate your mood. A lot of amino acids are required for the production of serotonin, dopamine, these chemicals that these neurotransmitters that uplift your mood. Look at your gut health. Your gut reflects how you are feeling. Okay, if you are feeling stressed, your gut, you may suffer from acidity, or your gut motility can slow down or it can speed up. Healthy food for your gut includes fruits with their peel, vegetables with peels, beans, probiotics, probiotics like curd, yogurt, kefir, fermented food, bananas. Okay, beware of how caffeine can affect your mood. It can cause sleep problems, especially if you drink it close to bedtime, and some people find it makes them irritable and anxious too. Caffeine is found in coffee, tea, cola, energy drinks, and chocolate as well. So be very careful, specifically if you're taking mental health medications as well, if you're undergoing any mental health disorders, and if anyone is taking mental health medications as well, you have to be very careful about the use of caffeine on a day-to-day basis. Sharing meals with other people. Eating meals with other people as has many psychological, social, and biological benefits. They give us a sense of rhythm and regularity in our lives. So being around people while you eat your meal, it will boost up your eating habit. Okay, in many ways, we'll discuss that. A chance to reflect on day and feel connected to others, telling about your day to others, opening up. Okay, biologically, eating in upright chairs helps with your digestion. Talking and listening to people while you eat, it will slow down your eating. Okay, so you will chew more, you will take your own time to eat, so you will not overeat, you will not end up overeating, you will eat enough amount of food and feel satiated, so you don't eat too fast and it lead to indigestion. Page numbers are not available. These are not topics. These are topics not from the textbooks. Make the most of meal times by setting aside at least one day a week to eat with family and friends. Choose a meal that is easy to prepare so it does not become a chore. Okay, it should be easy to prepare, easily accessible, the ingredients. Share responsibility while you cook so that everyone has a different task. One will be doing the shopping, one family member or friend can set up the table, cooking. After eating, one will take the responsibility of washing up the utensils. Okay, and keep the television and smartphones off. Not just telephone. Nowadays, keep the smartphones off as well. Don't use smartphones on the dining table when you are sitting with others, so everyone can talk and share. So this is a good mental health practice as well. Blood sugar levels. If your blood sugar level is lower than usual, you might feel tired, irritable, or depressed. Eating regularly and eating food that will release energy slowly, which means low glycemic index food, low glycemic load food. Okay, these can help your sugar levels steady. It will not surge your sugar levels in a very in a very short period of time. Okay, it will on a over a period of time, it will take 2 to 3 hours for the sugar level to rise up steadily and go down steadily. Different people may have different reaction to the same food, but generally food releases energy more that which releases energy on a slow basis. These include whole grain bread and whole grain cereals, nuts and seeds, brown pasta, brown rice. These are most common cereals. Majority of the food that you eat are cereal based, pulse based. So these are the foods that you can include which are releasing the energy slowly. Drinking fluids. If you live with a mental health problem, you may not have energy or motivation to drink water. Okay, even if you know it's good for health, but you may not have the uh, mood or energy to get up and drink water and stay hydrated. So if you become dehydrated, it can make it more harder for you to concentrate, think clearly, work on your mental health. Okay, in dehydration it's difficult. So water, tea, coffee, juices, smoothies, all these can help you feel hydrated. Soups. Okay, when you feel low, having a bowl of soup, specifically in these winters, can uplift the mood. It can keep you hydrated as well. Okay, some of these can also contain caffeine or sugar, which can also affect how you feel for different reasons. We will discuss on that, sugar and caffeine. So stay hydrated, drink fluids. Fruits and vegetables. Eating different fruits and vegetables can add a. Am I audible? Is my screen visible? Am I audible? Is my screen visible? So drinking fluids, you have to stay hydrated. If you become dehydrated, you will not be able to concentrate, think clearly, which may again affect your mental health adversely. Okay, specifically if you are on medications, if like lithium and all, you have to make sure that you are drinking your water or other fluids regularly. You don't get dehydrated. Fruits and vegetables. Eating different fruits and vegetables can also add a good range of nutrients in your diet. Okay, fresh fruits and vegetables can fresh fruits and vegetables can sometimes be expensive and more difficult to prepare. So frozen, tinned, dried, juiced fruits. Instead of juiced, go for blended fruits. Okay. Am I audible? Is my screen visible? Am I audible? Is my screen visible? Fruits and vegetables slide. Am I audible to all? Okay, so instead of going for juiced fruits, you can go for blended ones that you use in smoothie. In juiced ones, the entire fiber part is removed. Okay, so go for blended fruits, blended juices. Okay, in which the fiber part is not removed much, not filtered out much. Okay, and it is good in terms of glycemic load and index as well. Eating the fruits are more healthy as compared to juicing them. Okay, fruits and vegetables all count towards your five a day too. If you want a cheaper or easier alternatives, fruits and vegetables together, five servings on a daily basis is completely fine. Protein. Diets that are higher in protein can support your mental health. Proteins contains these chemicals called amino acids, which your brain requires to produce neurotransmitters. As I mentioned earlier, like serotonin, dopamine, okay, they all require amino acids to be produced. Okay, these are neurotransmitters that make you happy. Okay, so protein is required. These help to regulate your thoughts and feelings. You can find protein in foods like legumes, nuts, seeds, milk, fish, eggs, cheese, lean meat, soya products, etc. If you're finding it difficult to get enough protein in your diet, you could try adding some grated cheese to a meal as well, or having a glass of milk, or you can eat a packet of nuts or seeds as well. So in these matter, you can add more protein into your diet, okay, without increasing much of the bulk of your diet. So for preparing the neurotransmitters, the happy hormones like serotonin, dopamine, adrenaline, okay, for these hormones you require protein in your diet. Then caffeine. Caffeine is in tea, coffee, chocolate, cola, other energy drinks, soft drinks as well. It is a stimulant. Okay, it means it can give you a quick burst of energy, but it can also make you feel anxious and depressed. So people who already suffer from anxiety disorders or depressed, okay, you should avoid having caffeine. They will disturb your sleep pattern as well if you have insomnia or any other sleep related mental health disorders. Just before you retire for the bed, try to avoid taking caffeine. It can give you withdrawal symptoms like feeling irritable or depressed if you suddenly stop having it. And if you think caffeine is affecting your mood, you can try slowly reduce the amount of caffeine. Try to avoid coffee or tea as much as possible. Or if you still like the taste of it, if you don't want to leave the habit of it, you can go for the decaf version of coffees as well. In decaf version you will not have the caffeine, or the caffeine part is very diluted. Okay, that is a decaf version. So that you can have for the taste factor. Healthy fats, your brain needs certain healthy fatty acids like omega-3 fatty acids, omega-6 fatty acids to keep it working well. You can find these healthy fats in nuts, seeds, avocados, oily fish like sardines, mackerel. Okay, they are also these kind of fish, sardines and mackerel. They're very cheaper. Even if you buy the fresh one or tinned versions of it, these both are cheaper versions of it as compared to salmon, kingfish, tuna, etc. Okay, small fishes basically, if you go for small ones, okay, they are much better as compared to the big fishes which are costlier. So having healthy fats in the diet is important. Omega 3 and omega 6 is important for your brain health, the vision, your vision as well, eyesight and vision. Foods that are good for your gut health. Sometimes your gut can reflect your mood. If you're stressed or anxious, this can make your gut slow down or it can speed up. Okay. Sometimes when like it happens before exams, you like to pee more or you may uh, try to defecate more. Okay. It means your anxiety is speeding up your peristalsis movement. Sometimes you will suffer from acidity, constipation. Stress can work both the ways. This can lead to problems with digestion, such as feeling bloated or constipated, or you may not feel hungry at all. So, if you're feeling stressed and you think it is affecting your gut, you could try some relaxation techniques or breathing techniques. If you can also try eating more food that support healthy digestion, for example, fruits, vegetables, whole grains, or pulses. Okay. Uh, if possible, try to avoid tinned ones, tinned legumes. Go for the fresh ones. Soak the legumes and pulses. Okay, nuts and seeds, you do not have to soak them. Only the legumes and pulses you can soak them. It is better to soak them and then use the legumes and pulses. Nuts, you can have dry nuts as it is. It won't affect your health much. Or pulses such as tinned or dried grains, peas, lentils. Probiotics, add more probiotics like yogurt, tempeh, kimchi, curd. In India, it's better to go for buttermilk, curd. If you like the Korean cuisine, you can add more kimchi if the spicy version of fermented food. Fermented pickles can be used. Less spiced, vinegar dipped pickles of vegetables can be used. It's good for gut as well. Alcohol. Drinking too much of alcohol can disrupt the chemicals in the brain that are important for good mental health. some of the people who suffer from with mental health problems can depend on alcohol to feel good and to like kind of put their emotional traumas or other feelings bottled up or to shutter it down. You may use alcohol as a way of escape. Okay, so if you use alcohol this way, there are high chances that it is leading you towards addiction, alcohol addiction. Then food intolerances and allergies. If you have any uh, food intolerance that you know of, inform your dietitian, inform your doctor about it because it should not affect with your medication. If you're not aware of your food intolerances or allergies, you can definitely get a checkup done. Food allergy checkup is done. There are around 41 injections that are given, or 41 different types of food allergens can be identified. Not just food allergens, regular allergens can also be identified. Intradermal injections are given for this test. For example, this can be an intolerance or allergy to wheat, dairy, or yeast. Medication and food interaction. Some foods can be dangerous to eat if you are taking certain medications like lithium and all. If you're taking for ADHD or for anxiety disorders, if you are taking lithium, this if they might stop a medication from working as well. So certain side effects are also there with medication. So those side effects could bring loss of appetite. So you may have to take some medication before or after you eat or drink based on whatever prescription it has been given. Others may increase or reduce your appetite as well. Some medications can increase your appetite. Some can reduce your appetite. So the doctor should explain the possible risk and side effects of every medication whenever you're getting a prescription. So this will help you decide whether you want to take this medication or not. Okay. The patient still have a choice. Any patient or the patient party, they still have a choice to put the patient through medication treatment or not. So knowing the side effects becomes easier for the patients to develop that skill of going forward with the treatment or going for any other alternatives. Write down the food that is making you feel uh, worse. Okay, if you're not able to and identify, at least keep a note, a diary of food that you eat, and mark the food as you go, whichever soon after having it. How do you feel? Okay, if you make notes of that, you will identify over time that which are the foods that make you feel worse, okay, or better, the food that keeps you awake or give you more energy, the food that are affecting your sleep cycle, okay, making you drowsy or not allowing you to sleep. You will identify this pattern, and you yourself will identify which food works for you, works in your favor, and which is not working. Try to accept help from others. Usually, when the patients are not feeling well, they sometimes get offers of help from others, but they may decline it because of some stigma associated or because of their own demons that they're fighting. Okay, they may try to avoid it. So, if you're struggling and someone offers you a help, you could suggest that they help in practical things like not just supporting you with words, just practical things like shopping and ordering food, because the person who is suffering from mental health disorder may be too tired to do all these uh, technical works. Okay, so you can help a person who is suffering through mental health disorders through these technical support, practical supports like shopping for them, shopping or ordering food for them, planning their diet, cooking a meal for them, okay, eating with them, not allowing them to sit and eat alone, okay. So all these steps, all support in all these steps will make the entire cooking and eating process much acceptable for the patient, less daunting for the patient. Try to make the food preparation process easier, like it can take a lot of energy to prepare certain food or clean up afterwards. So this may feel especially difficult when you are feeling unwell. So tips that would help you process this feeling better is wash up as you go. Whenever you're preparing food, if you are looking at the wash basin or the sink, you see a lot of utensils being collected. And if you see a whole lot of utensils that are collected and you have to wash them later, that can also make you feel anxious. That can also make you feel nervous. So in that situation, wash up the utensils as you go so that you're not left with a bulk of utensils to be washed later on. This may feel especially difficult when you are feeling unwell. And this may also help you feel less overwhelmed by the amount of washing up you have to do after you have finished preparing meal. If while preparing meal you are washing and going, you will feel much less stressed. And in some cases, it is better to use disposable plates and kitchen towels for a short while and then move on to the regular plates. Rinse the dishes before washing them. This can stop the food from sticking to them and make them easier to wash up. Make all the food in one pot dish, okay, so that you don't have more utensils to wash. Some recipes and books also have one pot recipes, one bit recipes. You can search about that in Google and YouTube. You will get the recipes and the directions to cook it. Use pre-chopped frozen fruits and vegetables. This can also reduce a lot of time that you invest in cooking. Also reduce the amount of food which is going to be used in food preparation. Coming to the end part of this chapter, studies have shown that traditional diets like Mediterranean diet or traditional Japanese diet, okay, when you do the comparison with the Western diet, traditional diets have shown the lower risk of depression for people who follow the traditional diet, which means the Western diet, which has more carb, more unhealthy fats, okay, less fiber, these things may be causing some mental health disorders in the population as well. So scientists believe that this difference is because these traditional diets tend to be very high in vegetables, fruits, unprocessed grains, fiber, seafood, healthy fats, as compared to the modern food that is highly processed, highly refined. Everything has sugar, everything has preservative. Okay, so these come under the highly processed Western kind of lifestyle. So therefore, in West, people are more focused on adding yogurt, curd, kimchi, etc. in their diet to get back their healthy probiotics. So that's all about mental health and nutrition.